Yeah, so the thing is, I think I've mentioned this at the start of the conversation. It's just the fact that not everyone can do, or not everyone is allowed to do the same, like some different type of exercises. Now the fact that you go to the gym and you see someone running the treadmill at a very at a particular speed, that is very very high, does not mean that
Mm-hmm.
you're allowed to do the same. Some
Mm-hmm.
persons might have to actually have to start, small, like start with
Mm-hmm.
very low intensity exercise, especially someone that has not, that doesn't exercise regularly, or someone that has not gone to the gym in a while. I mean, if you should leave the gym for, let's say, 2 months, when you go back, you should not even try to like continue where you stopped. You should try to
Yeah.
like take it back a little bit to actually even prevent soreness. You know, it's just body soreness. Body soreness. It's just your body, your muscles getting sore, and that's why most people are actually discouraged from going to the gym or even exercising, because they might tend to do too much. Do you understand, of what they should be doing at a particular point in time? Not like
Okay.
you can't get there, but it's also a process. Do you understand now? Now, an
Yes.
example of restriction will be someone with heart disease. Do you understand? It could be congenital heart failure, like I've mentioned earlier. It could be various, heart disease. Someone who has palpitations as a result of heart disease, you should not, you know, do any form of exercise unsupervised. So there are a lot of restrictions
Someone
to
that is asthmatic.
someone that is asthmatic.
Mm.
Yeah, someone that is asthmatic. The thing is that there's bronchoconstriction. The lung muscles, because why exercise is important, why aerobic exercise is important, is the fact that even the heart muscles and the lung too, when you are working out, when you are exercising, you are also strengthening those muscles, and it's going to make them function well. You can't go to your heart muscle now and start and give them dumbbells to start coiling them to build their muscles. So how you strengthen your heart and lung muscles is by exercise. Do you understand now? By doing those aerobic exercises, basically. So
Yeah.
that's how you strengthen your heart muscles. Because even the heart is a muscle, and your lungs as well, that pumps, oxygen, that
You know,
transport oxygen.
yeah, when you were
Mm,
talking earlier, you were saying
mm.
that some people do certain exercise and their body actually give them signs, but they think it is a kind of
Yeah,
endurance
yeah,
when they
yes,
tolerate those
yes.
kind of
When they
signs.
continue, yes.
So you see, there was this time I was hiking and I
Mm,
was feeling drowsy. I had to just take a pause and then continue. Do you understand?
mm.
At that point, I was feeling drowsy. It almost felt like I would just fall down and collapse. But after giving myself a little rest, I continued. I did not stop because of that. And I got better.
Okay, now what you are saying is when you were hiking, you felt as if you were going to collapse, but you continued.
I took a pause, then I continued walking.
That's the point I'm trying to make. Like you need to also know when to, you know, take a pause or rest. That's why when we prescribe exercise, we'll tell you, okay, you do 10 repetitions, 3 sets, and you rest for, 30 seconds in between. So for you to
Oh,
actually catch your breath and take in some oxygen.
oh,
That's why
okay.
that's why it is necessary for you to rest in between your exercises. Now, depending on, like I said earlier, depending on the type of exercise, mm, and also the person that is doing the exercise, what you can take, what you are used to, and also considering other signs like the blood pressure, the pulse rate as well, and the respiratory rate, which is the same thing, almost similar. The heart rate the, is the same thing as the pulse rate, as well as the breath, the respiratory rate. Do you understand? Those
Yeah.
parameters, those parameters needs to be normal.
Mm-hmm.
So in an ideal settings, those are the things that you actually see when you are walking on the treadmill. Now, you see the treadmill. Some treadmill have like a form of pulse oximeter measurement that you know that, oh, okay, my pulse is going beyond is going less than 92% already. Do you understand? My
Yeah.
pulse rate is more than my pulse rate is more than, let's say, 100 beats per minute. So I need to take you need to take but when you are exercising blindly, you won't know all these things. Do you understand? When you're exercising on your own, you might actually not know all these things, and those things might actually be happening and giving you signs. But because you don't know how, there's no way for you or means for you to actually measure them. So that's why I would also attribute or compare exercise with drugs that we take. Do you understand that?
Yeah.
There've been times where people take all sort of analgesic for pain. And
Mm-hmm.
we know that some of these analgesic even cause some, adverse effect or harmful effect to the body as well. For example, the non-steroidal anti-inflammatory drugs, the diclofenac and the ibuprofen, too much of them can actually cause ulcer.
Okay.
So the same way exercise too, like in exercise is actually a medicine, a drug itself. So I will still keep saying it, that knowing the right dosage is also very, very, very important. So that's why, all of us might not, I mean, in our society here,
Yes.
I know it's not very easy for everyone to have, or to see a physiotherapist or even have their own personal physiotherapist. But the thing is, let's just keep it, let's pay attention to, I would say, let's pay attention to our body. You see, some of these things don't even give any sign. But the thing is, when you pay attention to your body, you know when you actually need to rest. That's where I'm saying, why I said earlier that exercise is timed. You know that when you know that I want to exercise for 15 minutes, you know that, okay, I need to start with 10 minutes first. Then when I see that, okay, I can comfortably do, walk for 10 minutes, then you can, gradually increase it to 15 minutes. Do you understand? Because there's no
Yes.
limit to where you can actually train your body to. Do you understand? So
Oh,
you
okay.
start. It has to be progressive. You should not just for someone who doesn't exercise regularly, should not just wake up one morning and just start saying, "Oh, I want to go hiking and I want to get to the, to the top of the hill, or go as far as those that have been, hiking for, I don't know, for years or for months." So you need to start small. Everyone needs to start, small. Then you can progress over time. So I think that's the safest advice I'm going to give to anyone that will be exercising, and set a goal for yourself. Do you
Uh,
understand? If you
yeah.
want to, if you just want to keep fit, know the type of exercises that you need to do. Do you understand? You can talk to a physiotherapist. You can. I wouldn't say you should, Google everything, because not everything you see on Google is actually, peculiar to everyone. Do you understand? But the thing
Yeah.
is, just do your elaborate research. Know that, okay, I want to, build a little bit of muscle mass. That means you'll be doing, strength training as well. Okay, I want cardiovascular endurance. I want to be, fit all rounder. You know that you might have to infuse, cardio, strength training, stretches to your routine. So basically, when you set a goal for yourself, that's going to guide you in, choosing the right exercise and going about exercising the right way. Do you understand, for yourself? So that's going to be my general advice. As much as it's important for us to exercise regularly, we need to also know that there's a limit, or there have to be a limit. Do you understand? And it's
Yeah.
different. It's different for everyone. You
You
won't.
know, with what you said, I'm not sure if
Mm.
I should ask my next question, because my next question is about the appropriate exercise for certain health conditions. You mentioned high blood pressure. There are certain exercise they prescribe to pregnant ladies, that is peculiar to them and
Yes, you
stuff.
can ask the question. I think you should ask the
And
question.
then people with PCOS, there are certain kind of exercise they should be doing and certain kind of exercise they shouldn't be doing.
Mm.
So, as a physiotherapist, would you want to elaborate on that, just to give pointers for people that might be?
Yeah, like I said, that's why like I've said earlier, like it's not just like, how will I put it? It's not just white and black. Do you understand? Like exercise is not just white and black. You can't just say, okay, you go and start running. Oh, you go and start hiking. No, you. go and start lifting weights. No, it doesn't work that way. That's why that's why you need to consider the health status of the individual you are prescribing exercise to. You need to know their history. You need to know in some persons the some hereditary conditions that they have in their family. And the example you just cited as regards a pregnant woman now, or pregnant women in general. Now, someone who is in their first trimester. So
Yes.
that's where I'm going. That it's not just white and black. Someone who's in their first trimester, the kind of exercise you're going to give to such person is going to be different from when they are in their second trimester, and also when they are in their third trimester, because at that point in time, you are trying to achieve different goals. Now, in the first trimester, the kind of exercise that you should give to the pregnant woman should be one that would also help the normal development of the embryo or the fetus, the growing fetus in the pregnant woman, and also to increase their endurance. Do you understand? To increase their cardiovascular endurance, because they would need that. It's not easy to actually carry a baby for 9 months. Do you understand now? And you also need to consider other structures in their body, because there's already some hormonal changes taking place. Do you understand now? And they at different stages in the second trimester, the baby bump is already protruding, and there might actually be a strain on the back. So some of them can actually come down with low back pain. Do you understand now? So
Yes.
the typical exercises you give, or exercise you give someone who is not pregnant, is not the same you give to someone who is pregnant, because you need to think about the fetus, the growing fetus inside the woman at all times. So the kind of exercise you'll be prescribing should not put the baby at any risk or danger, because positioning matters a lot. Do you understand now? For
Yes.
example, from the second trimester, we don't advise pregnant women to sleep, laying on their back, because
Mm-hmm.
it causes something that we call iotocaval compression, like the aorta that supplies blood. There's exchange of gases and blood between the mother and the fetus, so it could actually cause very serious compression on the child. So that's why physiotherapy is just more than just prescribing exercises. Even the sleeping posture, the sitting posture, everything is very, very important. Like every detail is important. So, and also there are some modalities that we might actually use for someone who is not pregnant that you can't use for a pregnant woman. For example, the TENS machine to relieve pain. So there are different considerations in prescribing exercise for pregnant women. At different stages and different time of their pregnancy. So that's basically what I would say. Would encourage some stretches and even squatting. Now the squatting is always modified when it gets to their second trimester. Instead of the woman holding on to maybe like let's say their burglary or something to go down, you might just put a chair. Just tell them to just sit. You go up sitting, and then they stand from sitting and they go back to sitting like that. So that's a modified form of squatting. Do you understand now?
Yeah.
So that's the thing with working with a professional, and just doing what you like. The fact that now you might actually hear from people, from different persons, that but me, I was doing this while I was pregnant and nothing happened. Things like that happen, but it doesn't mean that another person will do the same thing and nothing will still happen. Something might happen if someone else does that. Do you
Yes.
understand now? So that's basically how you go about it. So basically, you want to help them manage pain. I mean, the back pain. And also there are some conditions that are peculiar to pregnant women. They tend to have tingling sensation in their hands, like pins and needle sensation in their hands, because of swelling of the arm, the hands basically. So there might be compression on the nerves. And so you give them exercises to help dislodge swelling from their arms. So that's why I'm saying that there have to be a goal. There's always a reason for giving exercise. You don't just wake up and just say you start running, like I said earlier. So, for example, something like them using a soft ball, like squeezing and releasing the ball, can help them to dislodge the swelling in their hands and also relieve the pain they might be feeling on their hands. They feel pain in the hands, they feel pain on their feet, like in their feet. They have low back pain. Those are the musculoskeletal conditions that are peculiar to pregnant women.
Okay, let's go on a short break.